Hey coders, let's look at drug therapy requiring intensive monitoring for toxicity under the high risk of morbidity from additional diagnostic testing or treatment. It is in line with high medical decision making. However, remember, to get high medical decision making, 2 out of the 3 elements must meet or exceed. So let's look at the guidelines for drug therapy requiring intensive monitoring for toxicity. So the guidelines state that the drug that requires intensive monitoring for toxicity is a therapeutic agent that has the potential to cause serious morbidity or death. The monitoring is performed for assessment of these adverse effects, not just primarily for the assessment of therapeutic efficiency. Intensive monitoring may be long-term or short-term. Long-term intensive monitoring is not performed less than quarterly. Monitoring may be performed with a laboratory test, a physiological test, or imaging. History and physical exam do not qualify. The monitoring affects the level of medical decision-making in an encounter in which it is considered in the management of the patient. The guidelines provide us with some examples. An example may be monitoring for cytopenia in the use of an anti-neoplastic agent between dose cycles. Examples for monitoring that do not qualify include monitoring glucose levels during insulin therapy, as the primary reason is the therapeutic effect, unless severe hypoglycemia is a current significant concern, or annual electrolytes and renal function for patients on a diuretic, as the frequency does not meet the threshold. My recommendation for coders is that if you work at a practice where the physicians frequently have medications that could cause serious morbidity or death and could kind of fall into this category, make sure that the providers are documenting not only the medication, how frequently they are monitoring it, and most clearly of all, they should document that they are monitoring for toxicity and not just therapeutic effects, because therapeutic efficiency is not sufficient to meet these guidelines. Hopefully this will help you in your day-to-day coding. Stay sharp, coders.